A resident refuses a scheduled bath. What should the CNA do first? A. Force the resident to bathe. B. Report the refusal immediately to the nurse. C. Ask the resident why and offer alternatives. D. Document refusal and ignore the situation. Answer: C. CNAs must respect resident autonomy. Exploring reasons and offering alternatives, like a sponge bath, balances dignity with hygiene needs. When removing a soiled gown from a resident within 4-line, which arm should be removed from the sleeve first? A. The arm with the 4-line. B. The arm without the 4-line. C. Both arms at the same time. D. It does not matter. Answer: B. Always remove clothing from the unaffected arm first to avoid disturbing the foresight, then carefully slide off from the forearm. A CNA notices a resident's meal tray has not been touched after 30 minutes. What is the best action? A. Take the tray away immediately. B. Encourage the resident and assist if needed. C. Report the refusal to dietary staff only. D. Leave the tray longer without intervention. Answer: B. CNA responsibilities include ensuring adequate nutrition. Encouraging or assisting supports resident intake before documenting or reporting. Which is the safest way to identify a resident before providing care? A. Ask the resident their room number. B. Check the name on the resident's chart. C. Use the identification bracelet and confirm verbally if possible. D. Ask another CNA who the resident is. Answer: C. Identification bracelets and verbal confirmation are the most accurate ways to ensure correct resident identification and prevent errors. While repositioning a resident, the CNA notices a reddened area on the hip. What should the CNA do? A. Report and document the finding. B. Apply powder and continue care. C. Massage the area to improve circulation. D. Place an ice pack on the area. Answer: A. Reddened skin can signal early pressure injury. CNAs must report and document it promptly to prevent worsening. Which of the following tasks can a CNA legally perform? A. Administering insulin injections. B. Changing a sterile wound dressing. C. Assisting with oral feeding. D. Giving 4 medications. Answer: C. CNAs can assist with feeding but cannot perform invasive procedures such as injections, sterile dressings, or 4 medications. The CNA finds a resident choking but able to cough forcefully. What should the CNA do? A. Begin abdominal thrusts immediately. B. Encourage the resident to continue coughing. C. Slap the resident on the back. D. Attempt to give water. Answer: B. If the resident can cough forcefully, the airway is partially open. Encourage coughing rather than intervening immediately. A resident on fluid restriction asks for water repeatedly. What should the CNA do? A. Provide the water to avoid conflict. B. Explain the restriction and offer comfort measures like ice chips if allowed. C. Ignore the requests. D. Refer the resident only to dietary staff. Answer: B. Residents should be educated about restrictions. Offering permitted alternatives helps compliance while maintaining comfort. Which is the best method to prevent infection during perineal care? A. Use the same washcloth for all areas. B. Rinse only with water. C. Apply powder after cleansing. D. Wipe from front to back. Answer: D. Wiping front to back prevents transferring bacteria from the rectal area to the urethra, reducing infection risk. When assisting a resident to ambulate with a gait belt, the CNA should place the belt A. Over bare skin. B. Around the waist, over clothing. C. On the chest just under the arms. D. Below the hips. Answer, B. A gait belt is placed snugly around the waist over clothing to provide safe support during ambulation. A resident complains of shortness of breath while lying flat. What is the CNA's immediate action? A. Call the family. B. Give oxygen. C. Encourage the resident to walk. D. Place the resident in Fowler's or semi-Fowler's position. Answer, D. Raising the head of the bed eases breathing. Administering oxygen is not within CNA scope. Which observation should be reported immediately to the nurse? A. Resident states they do not like the lunch. B. Resident complains of sudden severe chest pain. C. Resident refuses to participate in activities. D. Resident wants to go to bed early. Answer, B. Chest pain is a medical emergency that must be reported without delay. When caring for a resident with dementia who becomes agitated during bathing, the CNA should A. Restrain the resident. B. Skip hygiene care altogether. C. Argue with the resident until they comply. D. Stop and return later when the resident is calmer. Answer, D. Agitation is common in dementia. Stopping and returning later preserves dignity and reduces stress. A resident with diabetes has not eaten breakfast but receives their meal tray. What should the CNA do? A. Remove the tray to avoid waste. B. Report the skipped meal to the nurse promptly. C. Offer only fluids. D. Ignore the refusal. Answer, B. Skipping meals in diabetic residents can cause dangerous blood sugar changes and must be reported. The correct sequence for removing PPE is A. Gloves, gown, goggles, mask. B. Mask, gloves, gown, goggles. C. Gown, gloves, goggles, mask. D. Gloves, goggles, gown, mask. Answer, D. PPE removal begins with gloves, then goggles/face shield, followed by gown, and finally mask to minimize contamination risk. When transferring a resident from bed to wheelchair, which step is most important? A. Position the wheelchair on the far side of the room. B. Lock the wheelchair brakes. C. Leave footrests down. D. Place the wheelchair at the head of the bed. Answer, B. Locking wheelchair brakes prevents falls and ensures safety during transfers. A resident suddenly becomes unconscious during mealtime. What is the CNA's first response? A. Call the nurse and remain with the resident. B. Try to feed them small bites. C. Move the tray away and leave the room. D. Begin documentation immediately. Answer, A. The CNA must stay with the resident, ensure safety, and alert the nurse for emergency assessment. A CNA notices another staff member speaking harshly to a resident. What should the CNA do? A. Ignore it since it is not their responsibility. B. Report the incident to the nurse immediately. C. Join in to calm the resident. D. Wait until the family notices. Answer, B. Verbal abuse is reportable immediately to protect the resident's rights and safety. When measuring a resident's radial pulse, how long should the CNA count if the pulse is irregular? A. 15 seconds and multiply by 4. B. 30 seconds and multiply by 2. C. Full 60 seconds. D. Only until it becomes regular. Answer, C. For irregular rhythms, a full 60-second count provides accuracy. Which is the best example of a closed-ended question the CNA might ask a resident? A. How are you feeling today? B. Would you like to go for a walk now? C. Tell me about your family. D. What makes you feel comfortable? Answer: B. Closed-ended questions require a yes/no or limited response. Open-ended questions encourage more detailed answers. Which of the following best demonstrates maintaining resident dignity during toileting? A. Leaving the door open for ventilation. B. Standing in front of the resident and watching. C. Closing the curtain or door for privacy. D. Asking another resident to wait inside. Answer: C. Privacy during toileting is essential to dignity and resident rights. When feeding a resident with dysphagia, the CNA should: A. Offer thin liquids with a straw. B. Place the resident in high Fowler's position. C. Encourage rapid swallowing. D. Tilt the head back. Answer: B. Upright positioning reduces aspiration risk during feeding in dysphagia. Which is an early sign of low blood sugar in a diabetic resident? A. Excessive thirst. B. Trembling and sweating. C. Deep labored breathing. D. Fruity breath odor. Answer: B. Hypoglycemia often presents with tremors, sweating, and confusion. Which vital sign change must be reported immediately? A. Temperature of 98.4 degrees Fahrenheit. B. Pulse of 72 bpm. C. Blood pressure of 180/100 mmHg. D. Respirations of 16 per minute. Answer: C. Severe hypertension, 180/100 mmHg, requires immediate reporting to prevent complications like stroke. When providing mouth care to an unconscious resident, the CNA must: A. Use large amounts of water. B. Place the resident in side-lying position. C. Insert dentures before cleaning. D. Avoid oral care entirely. Answer: B. Side-lying position prevents aspiration of fluids during oral care. A resident suddenly complains of dizziness when standing. The CNA should: A. Encourage the resident to walk faster. B. Sit or lay the resident down immediately. C. Leave the resident to recover alone. D. Give them a glass of water. Answer: B. Dizziness upon standing may indicate orthostatic hypotension. Safety requires immediate sitting or lying down. What should the CNA do if they find a hearing aid on the floor? A. Throw it away if it looks damaged. B. Rinse it under water and return it. C. Report it and place it safely for cleaning/checking. D. Give it to another resident who needs one. Answer: C. Hearing aids are delicate and expensive. Report and store safely until checked or returned. Which is the safest method to remove a resident's dentures? A. Use gloved fingers and gently rock them out. B. Pull forcefully until they come out. C. Rinse with hot water while in the mouth. D. Use bare hands for better grip. Answer: A. Gloves must be worn. Dentures should be gently rocked and removed to prevent injury. A resident's care plan requires two-person transfers. If only one CNA is available, the CNA should: A. Attempt the transfer alone carefully. B. Ask the resident to help themselves. C. Wait for another staff member before transferring. D. Skip the transfer entirely. Answer: C. Safety protocols must be followed. CNAs should never attempt a two-person transfer alone. Which type of bed is prepared for a resident returning from surgery? A. Closed bed. B. Open bed. C. Occupied bed. D. Surgical bed. Answer D. A surgical bed is prepared in a high position with linens folded back, ready for a post-op resident. A resident suddenly becomes incontinent after being continent. What should the CNA do? A. Report this change to the nurse immediately. B. Provide more fluids. C. Ignore it since accidents happen. D. Give toilet training independently. Answer A. A sudden change in continence may indicate infection or medical issues and must be reported. Which of the following is an example of objective data? A. Resident says they feel dizzy. B. Resident states they have pain. C. Resident is sweating and pale. D. Resident mentions missing their family. Answer C. Objective data are measurable observations such as appearance, whereas subjective data are resident-reported. A resident with Parkinson's disease may need assistance with eating because of A. Poor vision. B. Tremors and difficulty coordinating movement. C. Memory loss. D. Poor appetite. Answer B. Tremors and Parkinson's interfere with self-feeding, requiring CNA support. Which action is appropriate when caring for a resident with a urinary catheter? A. Keep the drainage bag above bladder level. B. Pinch the tubing to speed drainage. C. Disconnect tubing frequently. D. Position the tubing to hang loosely without kinks. Answer D. Tubing must remain unobstructed in drainage bags kept below bladder level to prevent infection and backflow. Which is the correct way to document in a CNA's notes? A. Resident seems upset, may be sad. B. Resident ate 50% of meal at lunch. C. Resident is angry at staff. D. Resident probably has a fever. Answer B. Documentation should be factual, measurable, and objective. Recording exact intake is appropriate. A CNA finds a resident wandering in the hallway at night. What should the CNA do? A. Lock the resident in their room. B. Ignore the behavior. C. Call security immediately. D. Calmly redirect the resident back to their room. Answer D. Redirecting calmly maintains safety and respects dignity for residents who may have dementia. Which is considered a restraint alternative? A. Tying the resident to a chair. B. Using a low bed with floor mats. C. Locking the resident's wheelchair. D. Placing a belt restraint. Answer B. Alternatives include low beds, alarms, and mats instead of physical restraints. Which is an appropriate CNA action when collecting a sputum specimen? A. Ask the resident to spit saliva only. B. Collect the specimen before breakfast. C. Use the same container for multiple residents. D. Touch the inside of the sterile container. Answer B. Early morning specimens provide the best results. The container must remain sterile. What is the first step if a fire breaks out in a resident's room? A. Extinguish the fire immediately. B. Run for help. C. Remove the resident to safety. D. Open all windows. Answer C. Following race protocol, the first action is to remove residents from danger before attempting to extinguish. A CNA overhears a resident's medical information being shared in the cafeteria. What should they do? A. Report the privacy breach immediately. B. Ignore it since it is normal conversation. C. Share additional details. D. Record the information in their notes. Answer A. Sharing medical information outside care areas violates HIPAA and must be reported. Which is the most important safety measure when assisting a resident with oxygen? A. Allowing smoking only outside. B. Keeping oxygen tank near heat. C. Ensuring no open flames nearby. D. Placing tank under the bed. Answer C. Oxygen supports combustion. Keeping away from flames is the most critical precaution. If a resident with Alzheimer's disease becomes combative during care, the CNA should A. Argue with the resident. B. Step back and try again later. C. Restrain the resident immediately. D. Forcefully continue care. Answer B. Pausing and returning later reduces conflict and maintains dignity. A resident is on strict bed rest. To prevent complications, the CNA should A. Provide frequent position changes. B. Keep the resident in one comfortable position. C. Avoid using pillows or supports. D. Limit fluid intake. Answer A. Frequent repositioning prevents pressure injuries and improves circulation. The best way for a CNA to support resident independence is to A. Do everything quickly for the resident. B. Allow residents to do tasks they are able to perform. C. Discourage participation in activities. D. Provide no assistance at all. Answer B. Encouraging independence boosts self-esteem and promotes functional ability. Which is a CNA responsibility in the admission process? A. Completing the medical diagnosis. B. Explaining complex medications. C. Assisting with orientation to the room and facility. D. Writing physician orders. Answer C. CNAs help residents settle in by orienting them to their environment but do not handle medical diagnoses or orders. Which of the following is the safest method for disposing of a used razor? A. Place it in a sharps container. B. Wrap it in paper towels and trash it. C. Rinse it and reuse. D. Place it in a laundry bag. Answer A. Razors are sharp items and must be disposed of in designated sharps containers. A resident with limited mobility requests to use the bathroom. The CNA should A. Encourage use of a bedpan only. B. Assist the resident safely to the bathroom. C. Refuse because it takes too much time. D. Tell them to wait until family visits. Answer B. Promoting independence and respecting requests ensures dignity while maintaining safety. A CNA must weigh a resident daily. To ensure accuracy, the CNA should A. Weigh the resident at different times each day. B. Use different scales as needed. C. Weigh the resident at the same time daily with the same scale. D. Estimate the weight if resident refuses. Answer C. Consistency in timing and equipment ensures reliable weight tracking. Which behavior demonstrates active listening when a resident is talking? A. Interrupting to share personal stories. B. Maintaining eye contact and nodding. C. Turning away while working. D. Checking your phone. Answer B. Active listening requires attention, eye contact, and body language that shows engagement. The CNA is caring for a resident on contact precautions. Which PPE is always required? A. Mask. B. Gown and gloves. C. Goggles. D. Shoe covers. Answer B. Contact precautions require gown and gloves to prevent the spread of infection.